Welcome to AETCM, the Emergency Medicine Channel.
Yes.
It's a case of a 19-year-old boy with no comorbs, alleged history of deliberate self-harm with 3/4 bottle of 51 ml, 10% Cypermethrin and an unknown amount of avion or MERS,
Known amount of
avion, vitamin E.
Evian. Okay.
Avion.
Okay.
Evion, omeprazole, augmentin and cetirizine. Initial 10-second assessment, airway patent able to complete full sentence, no stridor, pooling of secretion, hoarseness or gargling, breathing, respiratory rate of 20 per minute, saturation of 99%, on auscultation.
Cypermethrin is a pesticide.
Pesticide, okay.
So airway.
Airway, we have to look for any excessive secretion. Cypermethrin.
Because we have to differentiate it from
OP poisoning.
Organophosphate. Organophosphate usually presents with so much of secretions. Usually OP, what are the clinical features in OP?
OP poisoning mostly with hypersecretion,
What?
salivation.
Sludge BBB. What is that?
Salivation, lacrimation,
Salivation, lacrimation, urination, diuresis, gastric emptying, bradycardia, bronchoria, bronchospasm. Sludge BBB. Right?
Yes.
So if you have this thing, you're suspecting a organophosphate. And then you'll have to wear all your personal protective equipments before examining the patient. Because through skin itself, you can yourself can get poisoned. So this is Cypermethrin.
Cypermethrin is basically a sympathetic pyrethroid insecticide.
Okay, can you go ahead with your this thing?
Okay, sir. Then breathing, respiratory rate is 20 per
minute. So the airway
minute.
part is clear. No secretions,
no secretion. Patent able to secrete, able to complete full sentence. Breathing, respiratory rate of 20 per minute, saturation of 99%. On auscultation, bilateral air entry present with no added sounds. Circulation, heart rate of 60 per minute, BP of 120/70, all peripheral pulses palpable. Disability, GCS of 130 mg per dl. Pupils is bilaterally equal and a GCS of 15/15. Exposure temperature is febrile. Then sample history, a 19-year-old
So basically in primary survey, you haven't seen any of those clinical features associated with, attributed to organophosphate or cypermethrin poisoning. So primary survey is completely clear. Okay.
So it's a 19-year-old boy with no comorbidities. Sample history. 19-year-old boy with no comorbidities, with alleged history of deliberate self-harm with intake of cypermethrin, which is 3/4 of 51 ml, nearly 20-25 ml he had of 10% cypermethrin along with other drugs.
25 ml.
Approximately 25 ml. Where he at first he went outside.
So is it a toxic dose?
No, sir.
So what is the toxic dose?
Toxic dose is 100 mg per kg.
More than 100 mg per kg.
He went to outside hospital 15 minutes post injection with complaints of multiple episodes of vomiting and heartburn. And they put a Ryle's tube. Gastric lavage was done.
15 minutes after?
15 minutes after the intake.
Okay.
They put a Ryle's tube. Since the patient was within 15 minutes, they did a gastric lavage and sent here for further management. Then we admitted the patient. And
with Ryle's tube, actually, you can't do a gastric lavage.
No, actually,
because the lumen itself is too small. You have a separate gastric lavage. This thing because he has consumed a capsule Evion. Evion tablet is a big tablet. Through the Ryle's tube, nothing is going to come out. Okay.
And also in cypermethrin poisoning, gastric lavage is a contraindicator, since this cypermethrin may also contain other solvents which can cause chemical pneumonitis. But activated charcoal we can use if the patient is within 1 hour.
So they did a gastric lavage?
Gastric lavage. And send the patient here for further evaluation.
Well, activated charcoal they didn't give?
And they didn't give. Then,
so within 1 hour of consumption, usually in poisoning cases, we can try with gastric lavage followed by
activated
activated charcoal, provided there is no contraindication like these things and all, hydrocarbons and things like that.
Cypermethrin poisoning. Cypermethrin is a sympathetic pyrethroid
Then
insecticide.
allergic sample history you told them. Allergies is complete.
Sorry, allergy. There is no known allergies. Then medical address. Patient was not on any medicines. Past history, no significant medical or surgical past history. And last meal was taken half an hour before the intake of cypermethrin. And the exposure, there is no significant exposure to any.
In exposure part, what are we looking when in primary survey, when you reach E, what are you basically looking at?
Exposure is basically temperature.
Suspected organophosphate poisoning.
Any foul smelling, any solvents in the body.
Yeah.
You have to, in order to decontaminate the person. Then temperature of the patient.
Yeah, temperature then. In this particular case, temperature is fine. Yeah. Okay.
Temperature, here we also look for any
that foul smell, that kerosene smell, the smell of organophosphate, if it's there or not. Okay. Then all secretions.
All secretions.
Okay.
So, we admitted the patient under us for observation, and after 3 days, patient doesn't show any features of pulmonary edema or hypersensitivity.
So the patient was admitted in ER-ICU.
ER-ICU for observation.
Okay.
And
for 3 days he was there.
3 days. Okay. And post which, when patient becomes symptomatically better and no other signs of poisoning was shown, we discharged the patient. So
So ideally, if this patient should go to the green area, yellow area, or red area?
Yellow area, no green.
Yeah, yellow area is fine. There's nothing hemodynamically, nothing is there.
We have to suspect other hypersensitivity to pyrethroid or pulmonary edema or pneumonitis. We have to suspect. So we have to observe the patient. So yellow area.
Clinically, nothing was there.
Clinically, for this patient, nothing was there. Then this cypermethrin is actually a sympathetic pyrethroid, which is derived from pyrethrin, which is a natural compound extracted from chrysanthemum flowers. This is mostly used in agriculture and household pest control. There are two types of pesticide. There are two types of pyrethroid, type 1 and type 2.
It's basically toxic for insects, not for humans actually, unless it is taken in that severe doses.
Toxicity in humans is result mainly from accidental injection or inhalation, since this cypermethrin is in aerosol form, or dermal exposure, which is actually poor absorption through skin. It's mostly seen especially in children when accidental intake or in suicide attempt. So mechanism of toxicity is mainly this blocks sodium channel in neurotransmitter, causing prolonged depolarization and hyperexcitability. Also can affect GABA receptors at higher dose and increase nicotinic cholinergic transmission, and cause NORAD release. Also can interfere with sodium calcium exchange across the cell membrane. Then in clinical feature, mild to moderate patient have mild to moderate features are nausea, vomiting can occur, dizziness, headache, salivation, skin irritation, which can cause burning or paresthesia kind of sensation in skin, which start within 30 minutes and last up to 24 hours. Then eye irritation can also occur. In some patient, it can even cause allergic hypersensitivity kind of reaction, including bronchospasm, dermatitis, rhinitis, or even anaphylaxis can occur in some patients.
So main issues are
gastric and
gastro-related issues, nausea, vomiting, things like that, and then neurological all these tremors.
As in severe exposure can cause muscle twitching, tremors, paresthesia, seizures, pulmonary edema, CNS depression or agitation, respiratory failure, everything can occur in a severe high dose of cypermethrin intake. Okay. Then in management there is
And
no
then ocular exposure can happen, skin
occur.
exposure.
Skin
So you're actually supposed to clean everything,
clean
right?
everything,
Clean the body,
decontaminate.
decontamination.
Management is there is no specific antidote per se, but we can symptomatically and supportively manage the patient, including decontamination. If it is skin or eye exposure, we have to wash it thoroughly with the soap and water. If it is injection, we can put a Ryle's tube and give activated charcoal. Gastric lavage, since is contraindicated, since the cypermethrin may also contain solvents which can cause chemical pneumonitis. Then supportive care, airway, breathing, circulation we have to manage. Airway and breathing, if it is needed, desaturation is there, oxygen supplementation can given. In case of seizures,
Just like any other
benzodiazepines can
poisoning, you
be
give support to
given.
it. Okay.
In some patient, it can cause sinus bradycardia or hypotension. So low dose atropine can also be introduced in case of bradycardia as well as for hypersalivation.
Okay.
We
In
can
this
give
case, it is
atropine.
not indicated
It was not
because
indicated.
she didn't have any complaint. As
Then we have to monitor the patient for any cardiac abnormality, respiratory rate, and the neurological status of the
Okay.
patient. Usually prognosis is good with prompt care. Only in severe CNS effect only can cause problems. This cypermethrin is, there are two type of pyrethroids, type 1 and type 2. Type 1 is example is alletrin,
Pyrethroid.
permethrin. Pyrethroids are two
Pyrethroids.
types.
Okay. So this is type 2.
Type 2. Cypermethrin is type 2.
So what is type 1?
Type 1 is alletrin, permethrin, which can cause reflex. In toxicity, they can cause reflex hyperexcitability, paresthesia, fine tremors. So these features are called T syndrome. With the type 2,
T syndrome.
T syndrome. And with type 2,
What is it? What is it? T syndrome?
reflex hyperexcitability, paresthesia, fine tremors.
So tremors.
Tremors.
So tremors. Maybe like T stands for tremors.
Tremors.
T. Okay.
T. In type 2, that is cypermethrin, most commonly side effects are salivation, choreoathetosis, coarse tremors, seizures, and effect on skeletal and cardiac muscles. So since it is choreoathetosis is there and salivation, it is called CS syndrome.
Okay. CS. Choreoathetosis and salivation.
CS.
That is why type 2
Type 2.
pyrethroid, which is what we expect in
CS syndrome, yes.
this thing, cypermethrin.
Yes.
Overdose.
Then metabolism, mostly cypermethrin is metabolized in liver with the P450 monooxygenase and excreted
Cytochrome.
cytochrome P450 and excreted to kidney. If we do an endoscopy and see in case of severe poisoning, if in endoscopically, most probably we'll find esophagitis or esophageal ulcer, gastritis, gastric ulcer could be seen. Only life-threatening thing is seizure and coma can occur, which is the only life-threatening things which also cause, only will cause when we take a higher dose of cypermethrin. Then cardiac toxicity can occur, but it's very rare. Most commonly we see any ECG changes or sinus bradycardia, ventricle ectopics. Other side effects can pulmonary toxicity, aspiration pneumonia, pulmonary edema, everything can occur rarely. Most commonly the thing is cypermethrin and OP poisoning has similar symptoms. So we have to differentiate. The only way to differentiate OP poisoning from cypermethrin is serum cholinesterase level, which will be normal in cypermethrin poisoning. Then mostly both can be treated. In cypermethrin poisoning, most probably we will mistake it
But
for OP
this
poisoning.
thing what is that enzyme? Cholinesterase. Because we draw blood samples from here, but only in ICU will you be able to
measures cholinesterase.
Because the reports will come only then. By the time you treat, patient will also already be shifted to ICU. So you won't exactly know
Cypermethrin or
whether,
OP poisoning.
we won't be able to. An ER physician will not be able to know. But like general medicine doctors will know what.
Cholinesterase.
Is it OP or is it
cypermethrin?
Because we lose touch with the patient.
Cypermethrin, when patient is treated as OP in case of cypermethrin poisoning, this for cypermethrin only low dose aspirin is indicated. A dosage of 0.6 to 1.2 gram. But if we mistake cypermethrin poisoning as OP poisoning, we will get higher dose of atropine, and which can adversely affect the patient.
Atropine psychosis. Atropine overdose will cause atropine psychosis. Oh, that's okay. That physostigmine you can give in, or you can withdraw, stop atropine, continue with glycopyrrolate. Like that you can do. But this is atropine is indicated only if there is any clinical feature of
OP poisoning,
cypermethrin, such as CS, chorioathetosis and salivation. Tremors are seen in the other one, type 1 pyrethroid. In this case, nothing, you just, as patient is completely fine, you just simply like wait and watch, that's all. Okay, anything more to be added? Okay, thank you.